I think there are pros and cons to both models. I think there are fundamental differences between how I think healthcare is approached in UK and healthcare is approached in India. In India, healthcare is primarily out of pocket. So I think even today, I think 70 to 80% of spend is self-pay. So where the patient actually uh, pays for their own drugs, diagnosis, procedures, etc., etc. While here, obviously, it is free at point of care. I think there are pros and cons to both models. And in India, what I find is that because patients pay, they have a lot of choice, and in some sense, the money truly follows the patient. So if we come out with an innovation, um, if it is really good, then it's actually much easier to scale those innovations. The counter or the downside of that is obviously it really depends on the ability of the patients to pay or the family to pay. Between the well off and the not so well off, I think the downside of, I think, the UK or the model here is that the money truly does not follow the patient, even though there is probably a drive to figure out how patients um, can influence the choices that is made on their behalf. But in our experience, I think the UK system is a lot more about cost containment, and patients have a say, but not as much of a say as you would see.
Yes.
There's a company which is trying to operate into very fundamentally very different markets. I think it poses different challenges.
Yeah. Very different in terms of the benefits your solutions can generate for those two different markets.
Absolutely.